One of the things that we've seen, so I'm involved in the BELLINI program, so Andrew Spencer is presenting some of the mutational data around the BELLINI program and just showing that there's recurrent mutations in BCL2 that have been detected. We're seeing quite a large number of patients having P53 or 17p deletion abnormalities, and these high-risk abnormalities are predicting for relatively poor outcomes in that patient population. But there's some really quite interesting data coming out of the targeted therapy in terms of trying to predict patients who are not going to respond well. There's also a really interesting abstract, or a couple of abstracts, looking at BCMA deletions in patients exposed to BCMA targeted therapy. And the group from the DNFRBAT have shown that in some cases that may be associated with a specific genetic mutation in 16p deletion, which is where BCMA sits. So I think there's some really interesting information coming through on some of the targeted therapies and escape mechanisms that we're going to be having to cope with over the next few years. And I think, again, it speaks to the fact that combination therapies, even in these very new antigen-specific therapies coming through, is probably where we'll end up. And there's a number of abstracts looking at combination targeting of BCMA, CD19, CD38, and a number of other combinations, in particularly in CAR T cells, which I think is really exciting.